Welcome to the Concierge Care Health System podcast. The information shared in this podcast is for general informational purposes only and does not constitute medical advice. Listeners should be aware the content is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a physician or other qualified healthcare provider for medical questions.
Wow, it's almost dizzying how quickly healthcare is shifting, isn't it? I mean, not that long ago, seeing a doctor meant, a trip to their office. Now, this term telehealth just seems to be everywhere.
It certainly does, and it's a really fundamental shift. The National Institute of Biomedical Imaging and Bioengineering defines it pretty clearly as the use of communications technologies to provide healthcare at a distance. Okay. And the Mayo Clinic kind of builds on that, describing it as the use of digital information and communication technologies to access healthcare services remotely. Simple enough, right?
Right. So basically using our devices, phones, computers, that sort of thing, to connect with doctors or nurses without actually being in the same room. But it's more than just like a video call, I gather.
Exactly. Telehealth is really an umbrella term. It covers quite a few different services. You've got your virtual visits, maybe for a routine checkup or talking about new symptoms. Then there's remote patient monitoring, RPM they call it, where devices track health data right from your home. Think blood pressure cuffs or glucose monitors sending info back. And really importantly, there are teleconsultations. That's where, say, a local primary care doc can tap into specialist knowledge from someone miles away.
Yeah, that makes sense. It feels like it just exploded recently, didn't it? I definitely remember hearing about a massive surge during the pandemic.
Oh, the numbers are quite striking. If you look back at 2019, it was less than 0.05% of outpatient consultations used telehealth, like almost nothing. Fast forward to April 2020, right in the thick of it, and that figure peaked at a staggering 25%, a quarter of visits. It just fundamentally reshaped healthcare delivery almost overnight.
Which really brings us smack into the core of our discussion today, I think. Is telehealth genuinely bridging those gaps in healthcare access, making it easier for more people to get care? Or could it actually be, widening the divide, especially for people who aren't as plugged into the digital world?
That is the central tension, exactly. The material we've looked at offers some really compelling arguments and sometimes, contrasting viewpoints on this really critical question.
Okay, so our aim today is to really dig into this. We want to understand the powerful potential the real good telehealth can achieve, but also we need to confront the significant challenges posed by this digital divide and what that actually means for health equity.
Precisely. We want to get a clearer sense of whether telehealth is truly paving a way for more equitable access or if it risks leaving some folks even further behind.
Okay, let's start with the promise then, the exciting possibilities. What's the truly revolutionary aspect here? How could it fundamentally improve things, especially for those, say, currently struggling to get care?
Well, its capacity to just overcome geography is a huge advantage, especially for underserved populations. Just imagine someone in a really remote rural area. Suddenly they can connect with a specialist they might otherwise have to travel hours, maybe even days to see.
That's a total game changer for people in rural communities, isn't it? No more long drives, time off work, just for a consultation.
Precisely. And that directly hits another key benefit, cutting down on transportation burdens and costs. I mean, for people with limited mobility or those way out in isolated areas, just getting to an appointment can be a huge physical and financial hurdle. Telehealth just dissolves that barrier.
Yeah, and for low-income families, too, taking time off work isn't just inconvenient. It can mean lost wages they really need. A virtual visit could be a massive help there.
Absolutely. The convenience factor alone is substantial, and we're seeing this play out across a whole spectrum of applications now. Think about those teleconsultations we mentioned, a local doc in a small clinic getting real-time advice from a top specialist hundreds of miles away. That's powerful. Then you have virtual visits for, all sorts of things, managing chronic conditions like migraines or diabetes, dealing with acute stuff like a rash or a cold, even getting mental health support. And RPM, remote patient monitoring, isn't just about tracking data. Some studies suggest it can actually cut hospital readmissions significantly for things like heart failure. It helps shift care from being reactive to more proactive.
So like a virtual house call for a sinus infection that's actually becoming normal?
Exactly. And the scope is even broader. There's telehome care, providing remote support so people can live independently longer. And for really remote or critical situations, you've even got applications like teleemergency and tele-ICU, bringing critical care expertise virtually. Think also about telepharmacy, making sure people get their medications managed properly in underserved areas. Or school-based telehealth, bringing care right to students, even rehab. Physical therapy, occupational therapy, speech therapy, they can often be delivered remotely now too. It's just a remarkably versatile tool.
It really does sound like it could redefine how healthcare is delivered. And the mental health piece feels huge, especially with shortages of professionals everywhere and, the stigma some people still feel about seeking help.
Oh, it's transformative in that space. The numbers show it. In March 2023, a really significant chunk, 29% of all mental health visits and 21% of substance use disorder care happened via telemedicine. It's clearly become a vital and growing way to deliver behavioral health care.
Okay, so the potential benefits seem pretty clear, pretty undeniable. But then we bump up against this other side, the complexities of the digital divide. And it's not just about whether someone owns a smartphone, right? It's deeper than that.
Not at all. It helps to think of digital inclusion less like a single switch you either have access or you don't, and more like a network, like interconnected routes. There's this idea called the rhizomatic digital ecosystem framework. Basically, if one route is weak or missing, say, poor internet access, it impacts the whole system. It affects whether people can afford devices or feel comfortable using the tech, or if the connection is even good enough for a video call.
Okay. Unpack those roots for us a bit more. What are the key pieces of this framework?
Sure. So first, there's access. That's the fundamental physical infrastructure, having broadband networks and connection points actually available where you live. Second is availability. Is that infrastructure consistent? Is it reliable enough for the community's needs? Third is adequacy. Okay, you have a connection, but is it fast enough? Does it have the bandwidth for things like high-quality video telehealth? Because simply having internet isn't enough if it's too slow or keeps dropping out during a consultation.
Right, yeah. A shaky Wi-Fi signal during a crucial doctor's appointment. That's not going to work.
Exactly. Then number 4 is acceptability. And this covers the cultural and social side of things. Does it include digital literacy? Do people have the skills to use the technology? Are there language barriers? Do people generally feel comfortable and trust digital health tools? And finally, number 5 is affordability. Can people actually afford to get and keep both the internet service and the necessary devices, even with potential help like subsidies?
Wow. So it's this whole web of interconnected factors that really determines if someone can actually use and benefit from digital health. It's not just one thing.
Precisely. And it's so critical to recognize that this digital divide isn't just a tech problem. It's a fundamental social determinant of health. It really influences access to services. It affects whether you can use digital tools like patient portals or even just find reliable health information online. The Urban Institute has even called internet access a super determinant of health because it impacts so many other things.
So when we talk about telehealth expanding access, what we're really saying is it expands digital access. And that's a much more complicated picture than just, building another clinic.
That's a crucial distinction, absolutely. And if digital inclusion isn't baked into how we roll out telehealth right from the start, we face a very real danger of just making existing health disparities worse.
And that's the digital health paradox people talk about, isn't it? This really concerning reality that the very people who could potentially gain the most from telehealth, because maybe they have trouble traveling or affording time off, they're often the least likely to have the good internet or the right device or the digital skills needed to use it.
Yeah.
It feels like a cruel irony.
It really is. The very individuals facing those traditional barriers, transportation, cost, time, are now bumping up against these new technological ones. Without really deliberate, targeted efforts to bridge this multifaceted digital divide, telehealth genuinely risks deepening the chasm in health equity.
Okay, let's drill down into the specifics then. What are the really concrete barriers stopping people from having equitable access to telehealth?
Well, a really foundational one is just the lack of access to the technology itself and reliable infrastructure. We touched on it, but the differences in broadband internet access are stark. Rural areas, tribal lands, they lag significantly behind urban centers in connectivity rates. We're talking maybe 28% in rural, 24% in tribal areas lacking adequate access. And this isn't just abstract. Areas with strong broadband infrastructure see almost 50% higher telehealth use compared to areas with the weakest access. That's huge.
A 50% difference in uptake, wow. And I remember there was a program, wasn't there, trying to help people afford internet. What happened with that?
Yeah, you're probably thinking of the Affordable Connectivity Program, the ACP.
Yeah.
It provided really crucial subsidies for internet service to millions of low-income households. Unfortunately, that program lapsed. It ended in May 2024. And that's created a pretty significant setback, frankly. Many people relied on it for essential services, including accessing healthcare via telehealth.
Oof, that's a real blow to efforts to improve digital equity then. And it's not just about the connection itself, right? What about the actual devices people need?
Right. Device access and affordability are another big hurdle. Many individuals, particularly those with lower incomes, might not have a suitable smartphone or a tablet or a computer that works well for telehealth. Even if they have a device, maybe it's old or the cost of data plans is too high or replacing it if it breaks is out of the question. One survey in Nebraska found about 7.1% of people said lacking a device was a barrier for them. And then there's the often overlooked part: technical support, and just plain usability. Navigating new tech can be tricky, especially for older adults, maybe.
Yeah, it almost feels like being tech savvy is becoming a prerequisite for getting healthcare sometimes. And I know digital literacy, just knowing how to use it all, plays a huge role too.
Absolutely. Low digital health literacy is a really substantial barrier. We see it more among older adults, people with lower educational attainment, and some minority communities. It's not just about basic computer skills either. It's about having the confidence and the specific ability to navigate a telehealth platform, understand health information you find online, and really engage effectively in a virtual visit. Even people with basic digital skills might lack the specific confidence needed for telehealth. So targeted training and ongoing support are really crucial to address this gap.
And then there are the straightforward financial bits. Even if you have the skills, can people actually afford the ongoing costs?
Precisely. The cost of the device itself, plus the recurring internet bill, the data plan costs, it can add up and be a significant financial burden. That same Nebraska survey found 9% of people cited internet costs specifically as a barrier. And while insurance coverage for telehealth has definitely expanded, which is good, the whole landscape of reimbursement policies can still be pretty complex and create uncertainty for patients. Payment parity, making sure telehealth visits are paid the same as in-person ones, is vital. Thankfully, Medicare has made many of its pandemic-era telehealth flexibilities permanent, or at least extended them through late 2025, especially for behavioral health, which is now permanent, but patients might still run into unexpected or hidden costs sometimes.
It sounds like it's not just about the practical stuff either, is it? There are also these underlying social and cultural factors that come into play.
Indeed. Socio-cultural barriers and issues around trust are really significant too. Language barriers are a major one. So many platforms and health resources are mainly in English. There can also just be a lack of culturally sensitive design or delivery in some telehealth services. And trust is another key element. Some people might worry about the security and privacy of their health data online, or they just might feel less comfortable with a virtual interaction compared to seeing a doctor face-to-face. Although, it's worth noting, like we said, for certain sensitive conditions, telehealth can actually reduce stigma and make people more willing to seek care. So it cuts both ways sometimes.
It's just this really intricate web of interconnected challenges.
Yeah.
And I imagine the healthcare system itself, the providers and hospitals, they must face their own hurdles in making telehealth work equitably.
Absolutely. On the provider side, there can sometimes be limited training or even just acceptance of telehealth among some doctors or clinics. Integrating telehealth smoothly into existing clinical workflows, making sure that tech systems can talk to each other, that interoperability piece can also be significant challenges. Regulatory stuff like licensing doctors across state lines has historically been a barrier, though interstate compacts are starting to help with that. And maybe a fundamental issue is that a lot of telehealth tech just wasn't designed with inclusivity and accessibility truly in mind right from the very beginning.
Wow. It sounds like a really, really multifaceted problem then.
Yeah.
It definitely requires a comprehensive approach. So what are some of the key strategies? What interventions could actually work to bridge this digital divide?
Yeah, we need to tackle it from several angles. First, robust policy and dedicated funding initiatives are just paramount. This means sustained government investment to get towards universal broadband access and making sure it's affordable through things like the BEAD program. We also need to figure out long-term solutions to replace the support the ACP provided.
Okay, so job one is making sure the basic infrastructure is there and people can actually afford to connect to it.
Precisely. We also need to solidify and, where needed, expand equitable telehealth reimbursement policies. Keeping payment parity as the standard is important, and maintaining those beneficial Medicare telehealth flexibilities. Continuing to expand interstate licensure compacts also helps reduce barriers. And finally, on the policy side, we just need better data collection and serious equity monitoring. We need to know who is using telehealth and where the gaps still are.
Makes sense. And then what about the technology itself? How can we make these tools, the apps and platforms, inherently more accessible to everyone?
Yeah, technology design and accessibility have to be front and center. We need to really champion universal and inclusive design principles, making sure all telehealth platforms follow accessibility standards like WCAG. This means building in features like compatibility with assistive technologies, screen readers, things like that. It means closed captioning, adaptable interfaces that users can adjust, multilingual support, and just simple intuitive navigation. And the practice of co-design actually involving diverse users in the development process from the start is invaluable for getting it right. Plus, we need to prioritize developing solutions that work even on low bandwidth connections and make sure platforms work across different kinds of devices, not just the newest smartphone. That includes offering high-quality audio-only options when video isn't feasible or preferred.
Designing for everyone right from the beginning, that feels like a really fundamental shift in thinking. Okay, what about empowering people, giving them the digital skills they need?
Digital literacy and skills training are absolutely indispensable. We need to support and expand community-based digital literacy programs. They've shown real success in building people's confidence and competence with technology. Digital health navigators can also play a huge role here. These are people who provide personalized, one-on-one support to patients. They can help with everything from setting up the technology initially to troubleshooting problems later on. A systematic review actually highlighted how effective they are at recommending apps, guiding setup, and providing that ongoing tech help. And even healthcare providers themselves can play a part, maybe by briefly counseling patients on available digital tools and pointing them towards support resources.
So it sounds like a mix of practical training and that ongoing personalized support is pretty crucial. And how do we get at those underlying cultural issues and the trust barriers you mentioned?
Yeah, that requires really culturally competent and trust-building approaches. Healthcare providers need specific training on how to deliver culturally sensitive care within a telehealth setting. It's different from in-person. And having readily available language access services, interpreters, translated materials is essential. Building trust often comes down to clear communication and transparency about data privacy and security measures. And partnering directly with community-based organizations can be super effective. They know the community, they often already have trust, and they can help bridge understanding.
It all feels so interconnected, doesn't it? And what about the healthcare system itself? What bigger systemic changes are needed to make this work?
Right, those systemic factors are critical too. Integrating telehealth into value-based care models can help. That incentivizes using it effectively to improve patient outcomes, especially for underserved groups. We also need dedicated support for safety net providers, places like federally qualified health centers, FQHCs, and rural health clinics, RHCs. They need resources to implement telehealth programs effectively. And finally, we just need ongoing, rigorous research and evaluation. We need to keep studying telehealth's impact on health equity and figure out which strategies are truly the most effective for bridging that digital divide.
So it's definitely not just one silver bullet solution then. It's really a coordinated effort across a whole bunch of different fronts.
Precisely. It really demands a collaborative approach. You need policymakers, healthcare providers, tech developers, and the active engagement of communities themselves all working together.
Okay, so just to kind of wrap our heads around this, telehealth holds this absolutely incredible potential to really revolutionize healthcare access.
Absolutely. It offers this genuine promise of overcoming some really long-standing barriers and reaching people who've historically had a tough time accessing care.
But the huge caveat, the critical factor, is this digital divide, which, as we've discussed, is so much more complex than just having internet. It's affordability, it's skills, it's trust, it's even how the technology is designed.
Exactly. That digital divide is a massive impediment to rolling out telehealth equitably. It really encompasses all those interconnected elements we've been talking about: access, adequacy, affordability, acceptability.
And it seems really clear that we can't just be passive about this. We have to actively work to address these challenges on multiple levels if we want telehealth to fulfill its promise.
Absolutely right. We need those comprehensive strategies we talked about, strategies that target everything from policy and funding to designing user-friendly tech to providing good digital literacy training and fostering cultural sensitivity in how it's delivered.
And there are tangible steps, right? Investing in broadband, ensuring fair payment for telehealth, developing more accessible technologies, supporting those community-based digital navigators and literacy programs.
Indeed. All the recommendations for policymakers, for providers, for tech developers, for researchers, they all point towards a much more intentional and equity-focused path forward for digital health.
So I guess as we look ahead to the future of digital health, the really fundamental question seems to be, how do we make sure that this remarkable potential of telehealth actually benefits all members of society? How do we ensure it doesn't inadvertently just create new disparities or worsen existing ones?
That's the critical challenge, isn't it? And also the immense opportunity. We have to stay vigilant and really committed to ensuring that digital health serves to narrow the existing gaps in health equity rather than widening them even further.
Well, thank you for navigating this really complex terrain with me today. It's become so clear that while telehealth offers just incredible promise, realizing its potential for truly equitable healthcare demands this conscious, sustained effort to address all these multifaceted challenges of digital inclusion.
My pleasure. It's such a vital conversation and definitely one that requires ongoing attention and action. I think we all need to consider how these issues affect our own communities and the accessibility of care for the people around us.
Yeah. And maybe the final thought for everyone listening is, as healthcare becomes more and more digital, what responsibility do we all share as individuals, as communities, as a society in making sure that no one is left offline, left behind? It's a crucial question to keep asking ourselves.
Concierge Care, providing world-class, personalized care for patients and members. Taking a proactive approach by offering its free digital health clinic for anyone in need of these services. Reach out to us via our website, www.health.conciergecare.net, or give us a phone call at 786-809-2345.